to solve the whole problem. Thank you very much.
Well, Bob, thank you. And if I should be given the opportunity, I would do it.
You would?
I would.
Okay.
Because I'm not gonna go down easy in this thing. I'm not gonna go down easy in this thing, okay? I said earlier when I started, I'm not a political being, but I am passionate about medical care for you, the people, and I am passionate about our country. So I absolutely would. If I had the opportunity, you bet I would.
Talk to Bill about it.
Well, somebody has means and context, we'll do it. Another question.
Is there, I don't need that, is there any difference between reimbursement rates between Medicare and Medicaid?
Yes.
Touch on that a little bit.
Medicaid is even lesser than Medicare, okay? But Medicaid, there are some clinics that are labeled a federally qualified healthcare clinic. If you meet the qualifications of being one of those clinics, your reimbursement for Medicaid is actually higher. That's what Intercare is, okay, and that's why we try to kind of funnel the Medicaid patients towards them, because if they see them, they're reimbursed higher than what if I see them, the same patient. But yes, Medicaid is even a lesser reimbursement than Medicare typically. Another question?
Today, there was an article in the paper today about advanced nurse practitioners or something taking on more responsibility. What do you think about that? Doing prescriptions and blah, blah, blah.
That is happening. And I think there are some things that the nurse practitioner, that the PA can do. I think there are things that they cannot. Simple math, they go to school 6 years, I went to school 12 years. Okay. Should I be able to handle more medically complex things? Yes. Okay. Should a nurse practitioner or a mid-level, which we call a physician assistant, be able to handle the less complicated? Sure. Sure, okay? I mean, usually the patient calls me and tell me, Doc, I think I have a urinary tract infection. Well, if you, the patient, can figure out to have a urinary tract infection, certainly the mid-level can, okay? But when the hospital first implemented the hospitalist program, one of the things that they said is that we were only going to have internal medicine physicians on the services. That's not the case because they can't find enough internal medicine physicians. They now have nurse practitioners. I think the mid-level is great. I think they should be working in conjunction with a physician. I don't think they should be working at Walgreens or CVS pharmacies.
Right.
Any other questions?
You want the mic or?
I have more of a statement than a question. Anybody that thinks Obamacare is wrecking the country, that's just the first step. If we take a look around us daily, our freedoms, our rights, and our liberties are being stripped and gutted. We're at the point where there's nothing left. Excuse me. Let me ask you a question. How many of you in here can pick up the back of a car? Every single one of us together can pick up the back of the car. Together we can move mountains. And it's time to get back in their face like they're in our face. Please raise your hand right now if you want Obamacare. Does anybody in this room want this?
No!
Was anybody in this room properly represented?
No!
Did you guys have a vote on anything related to this?
No!
So our voice is not being heard. The more they get in our face, it's time for us to get back in their face. This is not the beginning of the war has begun. So, in a non-violent way, I will stand here, and I will stand here loud and proud. And we will represent the Tea Party with honor. We will help our neighbors. We will stand up with pride. We will stand up under God.
Amen.
God bless you for everything that you do.
Amen.
God bless you. And we'll take this country back.
1 minute and 42 seconds. This sums up Obamacare.
They didn't know he won.
Take the mic back.
Technical difficulties?
You can Google her, yeah, write
Yeah.
her name down.
That's very good.
Yeah, it really is. It's 1 minute, we can't get it, that's okay. It is 1 minute and 42 seconds, and in one sentence, she says it all.
Her name is Dr.
Barbara
Barbara Beller.
Beller, B-E-L-L-A-R.
How many of you have seen this? If you haven't seen it, you need to see it, because she does. She sums up Obamacare in one sentence. And it is just absolutely fantastic. And I think that Dr. Sherry is fantastic. And I want to oh, wait a minute. It's like, where's my microphone?
Don't forget Alan Day goes into this medication.
That was totally awesome. And I have a question for you. Where are the rest of the doctors?
Yes.
Where is our community of doctors standing loud against socialized medicine?
The chickens. Running scared.
No, my doctor feels.
Are there other doctors that you know of? If there are, maybe we need to have a panel of them. And, I don't know, maybe we could invite Fred up to,
Our cardboard cutout.
or we could use our famous cardboard cutout.
Claimant just show up and tell us he never voted for Obama.
Well, I don't
Maybe it's
care
time
what-
to stand outside his office.
Well, those are things that I agree, and I wholeheartedly agree with you. It's up to us, period. If we want our country, if we want our republic, if we do not want to go down this road of socialism, it is up to us. It is time to get up off the couch, quit throwing shoes at the TV, and do something. So now we're way behind schedule, but I don't care, because that was really, really good. It's fine. I just go with the flow, that's what I do. I'm not apologizing for that, not at all. Cindy Duran wants to just give you an idea of one of the ways that we can get other people involved. Let them know that we're alive and well, that the Tea Party is not dead, that conservatism is not dead. And so I'm going to turn the mic over to Cindy. Yes.
At the last meeting, we talked about some ways to get active in things, and we talked about just going to your township board meetings, and I mentioned a bill that was being passed in Delta Township, and it did get passed. The community did show up, but they passed it anyway. And it's an anti-discrimination bill, but it has a lot of ramifications for people in that area. I talked to a pastor at a training I was at, and they're very, very concerned about it in the churches. But the other thing I want to talk about is writing letters to the editor. So Sherry's going to hand out, and you might have to share these. I just made so many copies. We went to a training by Heritage Action a few weeks ago, and so I just kind of copied what they said, how to write a letter to the editor, and then I just gave some examples of letters. They included a couple from the Chicago Sun-Times, the Chicago Tribune. I included one of mine about Medicaid expansion. And then there's one that Harry Burr wrote about Tea Party people being wacko birds and just some other things. I thought these represented pretty much what the parameters were in the instructions in the workshop that we went to. This is a perfect subject to write a letter to the editor about what you heard here tonight. You go down this list and it tells you what to do if you haven't done it before. Just real quick, if you do the Herald, our newspaper, the Herald Palladium, I put some instructions because it's very confusing. You have to go down to the bottom. It's got some little print down there, and you scroll down to the bottom of the home page. You click on forms, and it lets you do it. They do have a word limit. I think it's 250 words, and if you go to the Kalamazoo Gazette, they have different word limits. So keep in mind what you do and how many words you use. I always do a cut and paste. And I put it on a different document and then cut and paste it in. Question back there?
When you're done.
Okay. And then you just hit submit and it goes in. They always call you to verify that you're the person writing the letter. They don't always call me anymore. I think they must be used to me. And sometimes I call, or sometimes I send a letter and it's in the very next day. So if you hit it just right, they're sometimes looking for letters to put in there. So real brief, I just encourage you to take a look at this, and they told us this is one of the most important things we can do. It doesn't seem like, it seems very passive, but it is important, and it just gets people talking. You need to get the subject material out there. This information from tonight would just be perfect to put in a letter to the editor. Yeah, the two most important things are the obits and letters to the editor.
That's what people read.
I mean, that's why I get my paper, for those two things.
If you go there in person and give your letter, no.
Right, there's no word count then. Yeah, so you can,
They just take it.
right, yeah. So you can do that also. You can drop it off there, so.
There's about 100 people in here tonight. They're about, give or take 20. It costs 50 cents to take a sheet of paper, an envelope, address it to 1600 Pennsylvania Drive. Tell them we don't like Obamacare. And if we don't do that, we're going to lose America. That's just one method to fight back, like the gentleman over there said.
They've taken America. It is up to us to take it back. That's where the misconception is, that they're going to take it. They've taken it. They're occupying it now. Another thing that we need to do is talk to every person on every street corner and inform them. When I was Halloween here, I bought an Obama mask at a local store, and I put a little Hitler mustache on it and timer across the forehead. Now, I didn't go out with my kids with it, because, that's their time, I'm gonna be their dad, I'm not gonna, but I did inform a lot of liberal-minded people that wanted to argue for a few hours, and yes, it is exhausting, but I educated some people on NDAA that they didn't know existed, and everything else. Every heart and mind changed in this country is going to win back America. And together, we can move mountains.
The
doctor's summary in terms of the ramification of Obamacare or the specifics are probably, I think, the best summary that I've seen is comprehensive. I think with the doctor's prediction, of course, it would be nice to be able to video that so that we could share it. Many of us, have friends, we host groups, we participate in groups. But I think that the video of this presentation would certainly serve, I think, the community, serve us, and I think our nation, if we could share that with other people. Because for the most part, and I think I'm fairly politically active, and I think I possess a certain amount of acumen, and I think that was the best presentation of what Obamacare in concrete terms from someone who's part of the profession, knows it's going to impact us personally. So,
So we have
Yeah.
Well, with Sherry's permission, if you would you be willing to share that PowerPoint?
You should have your like.
Okay. If I can get a copy of that PowerPoint,
and you have,
and you are signed up on our email list, then I would be very happy to forward that information to you, and then you share that with your friends and relatives, and so on and so forth.
thank you in advance.
And then we have videotape. So what's gonna happen with videotape?
Gary,
We can also put the video out on YouTube.
I'd like to know what Dr. Sherry thinks about concierge medicine and direct care. We're reading about how a lot of doctors are going around Obamacare and insurance companies by just having a contract with their patients. And is anyone, are any doctors in this area thinking about doing that?
Yes, I am actually thinking about doing a concierge model, okay? And I'm thinking, for those of you that have not heard that term before, concierge model is, as this lady said, it really is in some ways going around the insurance companies, okay? Because, guys, it broke my heart when I had a Medicare age couple tell me that they're spending more than $10,000 a year